For a mastectomy, there's lots of different things. You can do a lumpectomy where they just go in and take out the lump and some of the surrounding tissue. Of course, they will check your lymph nodes, that type of thing. Because of my cancer history, I knew that I was going to have a mastectomy. When I spoke with my breast surgeon and we talked about a lot of things, I decided that a double mastectomy was what I wanted to do because the chance of me getting breast cancer in the other breasts were fairly high. And that's for me with someone with Lynch syndrome and that kind of thing, and my cancer history. You can do a lumpectomy. You can just have one breast removed. Reconstructive surgery is a possibility. For me, it was not. Because of the ovarian cancer, I have a hernia right here, and a thing that they do up at Huntsman, which I did not know they could do, they did not want to put any foreign objects in my body. So none of the regular augmentation things would work for me. They were going to basically kind of do a tummy tuck, take off the bottom half of my stomach, cut it in half, put half here and half here. But because of prior surgeries, the ovarian cancer and the melanoma, that was not an option. I didn't have enough viable blood vessels and things like that to keep the tissue alive. With the mastectomy, it was actually quite painless. I didn't have a whole lot of pain. I was in and out of the hospital in 3 days. I did have tubes that would drain fluid on either side of my breasts. That was a little uncomfortable sometimes, not a big deal. You just drain your little bag and that type of thing. I of course have pretty long scars, from here to about right back here. And I think having dealt with the amputation of already losing a body part, of already having been bald once, the breast cancer was much easier for me to deal with. I knew I was going to be bald after the chemo. I had already dealt with the self-esteem issues of not having legs, so not having breasts was just another missing body part. And I kind of, in my life, have figured out that if I can live without it, it's okay. You can live without your breasts, you can live without your ovaries, your uterus, your cervix. You can live without your legs. You can live without body parts and still live a good life. And so if I figure if I don't need it, let's just do preventative and get rid of it and be done with it, and not have to have that extra worry later on. A lot of women don't feel that way. It's very hard for them to deal with the fact that they will be losing a breast or two. It's a way of looking at yourself as a whole human being. And I think I learned, like I said before, with or without hair, I'm still me. So I figured with or without legs, with or without breasts, I'm still me. It affects the way, it's hard. It affects the way I look at my body sometimes. It's hard to look at myself and know that I have missing body parts, and it's a little odd for people to see me. People stare, they look, and children are curious. They're great. Adults have a hard time looking you in the eye when you're missing so many body parts. Adults are very more self-conscious, I think, for you than you are for yourself. I think the most important thing to remember is that you are alive and that you have more time to spend with your family, that you have more time to accomplish your hopes and dreams, and you can do that without breasts, and you can do it without legs. It's very hard for younger women, I think, in particular. The media and our social lives are so focused on our bodies that we see ourselves as not complete or not whole or lacking in some way because we don't have these body parts that are valued, you know. The deeper value in my life is who I am, what I do with my life, what I'm able to accomplish. There are deeper things inside my soul that tell me I'm a child of God, and that means more to me than what I look like on the outside. Because, and I tell people this a lot, the resurrection for me is going to be amazing. You just better stand back on resurrection morning, because I've got stuff to do. There will be dancing, there will be running, there will be, I will be, I will have a complete physical body